Hi, this is the official podcast of the WCD. There's a World Congress of Dermatology which will be held next in Singapore in 2023. I am Dr. Etienne Wang from the National Skin Centre of Singapore and I will be a host for this podcast. You can listen to us on Apple Podcasts, Spotify, Pocket Casts and wherever else you get your podcast. Registration and abstract submission for the WCD 2023 are open, so please check out our website for more information. In this podcast, I speak with dermatologists and skin researchers from all over the world to talk about all things dermatology. Today, Sashen is back with another derm topic for discussion. Hi Sashen, how are you doing?
Hi Dr. Jane, I'm doing very well, thank you.
And what are we discussing today?
Well, today I thought we'd talk about something that hits very close to home, and that's a new agent that actually targets one of the itch pathways. And it's a late-breaking poster that was presented by Addendum Pharmaceuticals. So a lot of our patients with eczema, for example, the fact that itch is so severe in these cases, it really is debilitating for them. It affects their quality of life, affects their sleep. And that's something we ask about at each follow-up. So I thought we'd talk about this recent paper from Aslan, a poster, in fact, that they presented at the Society for Investigative Dermatology's annual meeting.
So Aslan Pharmaceuticals is based in Singapore, so that's very exciting for us and very happy to see that they presented this at SID. And of course, itch, I think only in the last maybe decade or so have we found many new drugs that target itch other than antihistamines. Can you tell us a bit more about this paper?
Exactly. So just to give you a bit of background, chronic itch is a hallmark and a major symptom of atopic dermatitis and some of the other type 2-driven inflammatory skin diseases. Now, in atopic dermatitis specifically, they've postulated that itch signaling is exacerbated by some pro-inflammatory cytokines, which then cause an immune response that disrupts the barrier. So in this study by Aslan, they showed that IL13 and IL4 actually act as neuronal enhancers to amplify the itch pathways through this IL13R alpha-1 subunit of this type 2 receptor. And that's where the inhibitor Eblasakimab comes into play.
Wow, that's very interesting. Yes, most of our atopic dermatitis patients usually say that antihistamines don't work. There must be some other pathways that is bothering them. How does this drug compare to, let's say, what's on the market right now, for example, dupilumab?
Right, so we all know that dupilumab does target the IL-4 and 13 in combination. So this study was actually an ex vivo study, which they did in humal dorsal root ganglia neurons, which were pre-treated with their drug, Eblasakimab. And then they used Eblasakimab and then IL-4 alone and IL-13 alone, and then a combination of IL-4 and 13. They captured neuronal responses by live cell calcium imaging. The new drug, Eblasakimab, actually significantly reduced cytokine-enhanced neuronal responses to IL-4 and 13-driven itch by more than 40%. This was compared to control conditions. Statistically significant. And this actually suggests that their unique mechanism of blocking the IL-13R alpha-1 could provide a molecular basis for significantly reducing itch in patients with moderate to severe atopic dermatitis. This was based on phase 1b clinical trials. And what's interesting is it's actually a potential first-in-class monoclonal antibody targeting the IL-13 receptor.
Yes, and that's developed in Singapore.
Yes, so in September 2021, it's all fairly recent, was when Aslan announced positive results from their phase 1b multiple ascending dose study. So it established proof of concept. And in Jan this year, they initiated the TREK-AD phase 2b trial, which is looking at the safety and efficacy of Eblasakimab in moderate to severe AD patients.
That's very encouraging and really excited to see whether this drug can be a new blockbuster drug from Singapore. But a lot of our patients are probably asking right now, how are they going to get to this drug? It's probably still many years away from being used in patients regularly. What can we do for our patients now to target itch in chronic atopic dermatitis?
Right. One thing I found very helpful seeing patients in the clinic was patient education. The initial visit where we actually talked to them about the itch scratch cycle, and how educating them that actually scratching does make the entire cycle worse. Teaching them methods of coping. I know in our severe eczema clinic, for example, at SGH, we have even a psychologist who the patients can see to teach them coping mechanisms to target the itch specifically. But I think education itself is a huge step, because once the patient knows what's causing their itch and how they can cope with it, it helps them get more empowered to controlling their itch.
Also, right now, the JAK inhibitors that we started using for some inflammatory skin conditions also work quite well for itch as well. So things like your abrocitinib and baricitinib.
Absolutely. And it's amazing to see what a big difference it makes in these patients' quality of life.
Okay, Sashen, well, that was very thought-provoking and I think very encouraging to see the future of controlling atopic dermatitis and chronic itch in Singapore and around the world. Thank you.
Thank you very much.
And now I'm very pleased to welcome Professor Tan Suat Hoon to the podcast. I'm at the end of my tour of heads of dermatology departments in Singapore, and now Prof Tan is, of course, ending of this season. Prof Tan is currently the director of the National Skin Centre of Singapore and is a senior consultant dermatologist and dermatopathologist. She's an adjunct professor with the Lee Kong Chian School of Medicine at NTU and also holds academic appointments at the Yong Loo Lin School of Medicine, National University of Singapore, and Duke NUS Graduate Medical School. Her areas of research and subspecialty are cutaneous lymphomas and skin cancer. Welcome, Prof Tan, to the podcast.
Hi, Etienne.
Well, very pleased to be able to talk to you. I think there's a theme over this season of the podcast. I've been speaking to various department heads of dermatology departments in Singapore, and we've been discussing about how the pandemic has affected our practice. NSC has definitely just emerged from a very challenging period. What lessons do you think we've learned during this pandemic?
I think in the beginning, in 2020, when the pandemic started, a lot of it was just learning, while we have to respond to the pandemic situation, we also had to learn how to, carry out our usual clinical services, so that everything, sort of allows us to continue to provide the services in a safe manner. So it was a lot of learning, on the job itself, because the response, of course, was not the same as what we went through, during the SARS in 2013, and this is a completely, new virus. But we had a lot of guidance and advisories from, the Ministry of Health, so that helps. The first thing that we tried, which was, going on the two-team system, that was really, not necessary at all, and it was also not efficient in terms of getting people to still continue to provide the service, because, that can't grind to a halt, in NSC. I mean, there's still patients who need to come, of course, the sort of essential work we could cut down, but there are still some patients who need to continue their treatment here in National Skin Centre. So I think a big part of it was learning how to cope with the pandemic, while still, continuing to provide essential services.
Yeah, I think not only NSC, but probably a lot of organizations have become a lot more nimble during this pandemic, responding to very rapidly changing kind of situations and regulations. Is that something that is going to be carried on into the future?
Well, we have been learning, right, for the last 2 years, and every, a few weeks, and sometimes it's in terms of days, you get new advisory. I think it looks like we are seeing the light at the end of the tunnel now, and that we're coming out of this pandemic in a better way. We are certainly learning a lot about how we should respond. And right now, the good thing is that we are able to provide services, to as close to business as usual level. But, certain things I feel, have changed for the long haul. For instance, all our teaching sessions and so on that we have been hosting pre-pandemic times. And then during the pandemic period, we had to go to a lot of online meetings and Zoom meetings and so on. Well, that has changed forever, I think, because people have learned that, they can do a lot of things offline and they can Zoom, while they are meeting their various commitments elsewhere, be it in another hospital or, from home. I think, it will be difficult to expect people to, sort of come back, to having physical meetings for now. Yeah, it may take a bit of time to encourage people, to come together again.
I think like a lot of officers that are trying to bring people back to the office, we need to give them a reason to come back. So for example, the CPCs, we can probably start having patients again at some point. So we can actually see that, CPCs are clinical pathological conferences where we talk about difficult cases and something like that. I think I did mention to you during this week's CPC that I don't really recognize any of the residents or the MOs because I see everyone through masks and it's very hard to get to know people that way. And I think that's something that really has affected us.
So I think this is something we really have to learn. People who have joined us during the pandemic, half the time we do not know who they are or what they look like. I think there's no running from the fact that we need people-to-people interactions. So certainly for our medical staff and, for things to carry on in an optimal way, we have to bring people back together again. Yes, having patience is one thing. Maybe having prizes, I don't know. We can have quizzes and I'm not sure. Maybe you can give me some ideas, how we can get people to come back. The companies, the IT companies, they're doing all they can, right, to make it fun, for their staff, to come back to work. And that's something that, everyone is starting to grapple with right now.
Well, that segues us into our next topic, actually, and that's the National Skin Centre new building. Maybe when the new building is ready, people will definitely want to come and have meetings there. Can you tell us a bit more about the new building, which will be, I think, ready next year?
Well, for one, we will have more than double our space, what we have now. So from a 5-story building, we are going to have a 10-story building. We can definitely look forward to more clinical space. And apart from the clinical areas, where you can provide services for various levels of patient care, you have subspecialty clinics as well. And we will also have some new facilities, what we have named, the Skin Allergy and Therapy Center. It will be sort of an ambulatory center where we can start our IV infusion services. Patients who may need sort of biologics, they would not need to be admitted to the ward, anymore for such treatment. And in the same facility, this is where our phototherapy unit is going to be, and that's going to be vastly expanded as well. So having both full body phototherapy as well as targeted phototherapy. We will have also research clinics that will be very close to our clinical areas. And that will be something quite new as well in the research clinics where skin imaging equipment will be located very close, to the clinical areas where, the equipment may be used either, as part of the clinical management or for research purposes. So I think there are many things to look forward to, and also, apart from clinical areas, the training areas and so on will also be vastly expanded. Pharmacy will also be, quite a big area. So overall, for most of the areas, we will increase by, 2 or 3 times more than what we have currently.
That's very exciting. And it also coincides with next year's WCD. Do you think we'll be opening up NSC for tours?
Well, that's provided the, National Skin Centre, the new building is open, before that. I mean, for now, I can only say that it is slated to be open in the second half of the 2023. So the exact date, we are not too sure yet. At the moment, we are, keeping a very close watch on the progress. Yeah, the last 2 years, we've seen quite a significant delay of the building construction, and it's mainly due to construction manpower crunch, and that is something not within our influence or control.
Okay, yeah, and so the WCD and the new building also coincides with 50 years of dermatology in Singapore, which I think is this year. What do you think the new building is going to be ushering into the future of dermatology for Singapore?
I think it will be, something that is really exciting because, not only do you have, enhanced resources, to provide services, for the clinical services, for the people of Singapore. The other thing is, it will also change the way we deliver our care. So for instance, in the subspecialty clinics, we are going more towards, team-based care. And in the new building, we have looked into how we position, things like interconnecting doors and so on, so that you can have non-medical clinicians like a nurse or a pharmacist, sit in next to the clinician, to provide the care for more complex cases. We will see a new era of care delivery, definitely. And there will also be, opportunities to test out, new models of care, and of which, I think, NSC can take the lead, in innovating, some of this care.
Definitely. And I think NSC is definitely a center of excellence when it comes to clinical care and delivery. I think that part of clinical care is also things like public education, public outreach, product development, stuff like that. Is that going to be something that's going to be also incorporated into the future of NSC?
Yeah, we do have, a new area that we've never had before, in the new building. And because of increase in space, we have actually allocated an area called the Patient Education Lounge. And that's going to be an area dedicated to providing educational resources for the patients, for visitors, for people, who may have the, interest, to learn more about the skin conditions and how they may, cope with the conditions. And that would be where we hope to see, how we reach out to our patients and their caregivers. And hopefully also a place where, various support groups, like the eczema support group, they can use the space, to meet and to learn from the clinicians, how they can manage their conditions.
Yes, that all sounds very exciting, and I really can't wait for next year to move into the new building.
Yes.
Okay, well, thank you, Prof Tan. That's all the time we have for today, and thank you so much for making time for this interview.
You're most welcome.
Okay, thank you. I'll see you soon. Bye.
Bye.
Thank you for joining us on another episode of the official podcast of the WCD. Don't forget to follow us on Facebook, Instagram at WCD Singapore, and check out the WCD website, wcd2023singapore.org, for more updates and content on the WCD. At that website, you can find links to register for the WCD and submit your abstracts for next year's WCD. And until next time, stay safe and use sunblock.